Good evening, ma'am.
Hello.
We are thrilled to have you join us for this crucial discussion on
Thank you.
Polycystic Ovary Syndrome, commonly known as PCOS. PCOS is a hormonal disorder that significantly impacts a woman's reproductive health. Your presence here today signifies a commitment to spreading awareness.
Thank you.
Voices is the women empowerment cell of the NMIMS Mumbai campus. By empowering women to prioritize their health and well-being, we promote open discussions and hormonal health. We are honored to have Dr. Bhavi Mody with us. She is an award-winning homeopath and nutritionist with an experience of over 28 years in women's health. As a leading hormone health expert, Dr. Mody's mission is to empower women to lead healthier and happier lives.
Thank you. Thank you for having me over.
So, ma'am, is PCOS genetic or due to lifestyle?
So PCOS is mainly due to lifestyle, but there is also a genetic component to it. So girls who have, sisters or mothers having PCOS or diabetes or insulin resistance are more prone to having PCOS.
Okay.
However, having said that, if you have a corrective lifestyle or if you are leading a healthy lifestyle, the chances of your PCOS coming up is very small.
Okay.
So it's all going to boil down to having a better healthy lifestyle.
Okay. Does having cysts on your ovaries mean you have PCOS directly, or are there other factors that must be met to say that you have the disorder?
You definitely need other factors. So out of 3, if 2 are present is when you will say that you have PCOS. So one is having cyst on the ovary.
Okay.
Second is going to be that you have any of the symptoms, like you have acne or you have hair fall or you have acanthosis nigrans, that's the thickening of the skin. So you have either symptoms. Also that you should be having hormonal imbalance. So you now check even AMH, that is anti-Mullerian hormone.
Okay.
So that is also one of the indicators for PCOS. And menstrual irregularity, that is one of the indicators for PCOS. So when either 2 are met,
Okay.
is when you will say that you have PCOS, because nowadays even though you have PCOS, your cyst may or may not show ovary,
Right.
the ovaries may not show cyst. So that's also a possibility, right? And you will not get a complete picture, so you have to see that what is available, and from that you make a diagnosis that okay, these are the criterias are met.
Okay.
So that's when you say that she has PCOS.
Okay. Okay.
That's called as the Rotterdam criteria.
Okay.
Yeah.
Does PCOS affect fertility rates?
Yes, so it's like a chicken and egg situation. It definitely impacts fertility. So if you have PCOS, it is said that you have the chances that your fertility will be impacted.
Okay.
So yeah, there is that chance of fertility being impacted.
Okay.
But it's not like you'll not get pregnant.
Okay.
You can get pregnant even though you have PCOS. So that's how you look at it, that okay, just because somebody said it, you don't go into that thing that okay, now I can't get pregnant.
Okay. How can you relieve PCOS symptoms and deal with the PCOS belly?
How do you relieve PCOS symptoms is with a healthy lifestyle. You make nutrition changes, you make lifestyle changes, and you manage your stress better. So these are the 3 things that you do to manage your PCOS better.
Okay.
Everything is interweaved. So you cannot separate anything that okay, only if I eat in a calorie deficit it will work, or only if I do 15k steps it will work. It's nothing like that. So you have to do everything together. You have to look at it as how holistic approach is what you need for when you're managing PCOS.
Yeah.
So you definitely pay attention to your nutrition. You have a balanced diet, you have adequate amounts of protein, you have fiber, you have complex carbohydrates, you have the micronutrients that are needed.
Yes.
Okay, so you need everything in balance. And with more activity, you are going into a calorie deficit.
Right.
So if you are in a calorie deficit, you lose weight, and that's when the belly goes. If you're not in a calorie deficit, no matter what diet you follow, no matter which influencer you're following, you're not going to lose that weight.
Right.
Okay, so there are no shortcuts to a healthy living. You have to stay consistent, make small, doable, sustainable changes.
Yes.
You are just feeding the food to it, feeling good, feeling the high for a temporary period, and then you're again back, right?
Yes.
The stress is not going away.
Yes.
So is it even working for you? If it's not working, then what is the solution? So that's where we need to find solutions
Right.
to managing our stress better. That can be small solutions. You don't really need big things, but you need to understand your priorities. You need to set your limits and then go ahead and do it.
Okay, yeah, that makes sense. Does PCOS ever go away?
No, it doesn't go away. Like I just said, that it's a lifetime thing, right? You can manage PCOS, but it's going to be a lifetime thing that you'll have to keep managing. The symptoms will vanish.
Okay.
But the PCOS stays, and you need to understand how to manage the symptoms
Right.
also, right? So again, everything is going to again and again boil down to eating healthy, living a healthy life, being more active, being adequate, adequately hydrated. And in your generation, it's also sleep. So what happens is, when you are sleep deprived, when you're not sleeping on time, not waking up on time, your circadian rhythm gets, a little distorted. It gets disturbed. So because of that, your hormones are impacted. Because melatonin is also the sleep hormone, right?
Yes.
तो उसके साथ अपने छेड़खानी कर दी तो all the other hormones are impacted. So again, to set your PCOS right, you have to sleep at the same time and you have to wake up at the same time. Now maintaining that time is important. You can set a timetable for yourself saying that, okay, by 11 o'clock I will be able to sleep. So then keep it 11. That every day I'm sleeping at 11 o'clock. Then one day 11, one day 10, one day 12, one day 1.
Yeah.
That should not happen. So decide a time and then stick to that and get 8 hours of good sleep. Now that's very, very important for a PCOS patient, that you should be getting that 8 hours of sleep to recover. The body needs to recover. If you're not sleeping well, the recovery is not going to happen well, and then your growth is going to get impacted, right?
Okay.
So that's why sleep is a very, very important missing piece in treating PCOS, which is often overlooked.
Okay.
And the blue light. Scrolling your phone, before you sleep is one thing that needs to be completely avoided with PCOS.
Okay.
But you have to ask yourself, is this something that's actually helping me manage my emotions? Because when you are in stress, you turn to emotional eating.
Yes.
You turn to stress eating. So if you're not going to manage your PCOS well, it's going to impact your heart. So you are going to be prone to more heart diseases.
Yes.
Diabetes is something that's seen more in PCOS women than otherwise. Okay. Ovarian cancer is also something you see more in PCOS patients than other people. The psychological impact that PCOS has on you, because because of PCOS, obesity is something that's going to come up, right?
Yes.
You see that PCOS and obesity go hand in hand, and because you are obese, then you have hirsutism, or you have acne, or you have hair fall. Now these are the symptoms of PCOS.
Yes.
So you may have either of these. So that actually takes away your confidence.
Yes.
Then there is body shaming that's happening, and people actually don't understand that you need to give that girl care. You need to give that girl that confidence to go out and be out in the world. But we don't do that as a society. We really need to understand that, we need to be there for people rather than pointing out at them that, okay, moti ho gayi hai, ganji ho gayi hai, ye kya ladko jaise baal gir rahe hai, or wo agar if you're having hirsutism, that's like, overgrowth of hair. So you have a beard kind of a thing. So you're teasing them. So that's something that, men and women both need to understand, that we need to support our girls rather than taking away and calling them names. So that's something that I strongly stand for, that's something that you need to do.
Right. Yeah. How do I know if I have PCOS?
So how do you know if you have PCOS is going to be that, yes, you would come up with certain symptoms. First, it would be that maybe irregular menstruation is the major, symptom that would come up, for which you'll start your investigations.
Right.
Okay, that's at the younger age. Or you may have too many acne which are cystic, like you have cyst in your acne.
Yeah.
So then you go to a dermatologist as the first line of treatment, right?
Yes.
That because I want to get rid of my acne. Everyone wants a plain skin and a beautiful skin and a glowing skin. So you visit your dermatologist and probably she would run a few tests, and that's how you're diagnosed with PCOS. Or you may have excessive hair fall, so then nobody wants to go bald, right?
Yeah.
We all love our hair. So that's where again you realize that okay, there's something wrong and I need to do something about it, and you do your investigations, and that's how you would come to know that you have PCOS.
Right.
And when you start with your investigations, you come to know that okay, you have excessive androgens like testosterone.
Yes.
So that's also one of the things that you consider when you are going to identify PCOS.
Okay.
I think I missed that when you asked me the question that are there any criteria. So yes, excessive androgens is also one of the criterias which I missed talking about at that point. So yeah, so you may want to check your testosterone, you may want to check your FSH, that is a follicle stimulating hormone.
Yes.
You may want to check your LH, which is the luteinizing hormone, your estrogen progesterone levels, and see where you are, right? So you'll do a hormonal assay. You will also do your ultrasonogram. That's the ultrasonography of your pelvis, which is where you will find those cysts on the ovaries sitting nicely. Okay.
Yes.
So that's how PCOS is going to show up. So initially, if you ask the symptoms, it's going to be hair fall, it's going to be acne, it's going to be dark skin, especially around the neck area, your arms, forearms are there. Then it's also going to be irregular periods, right? So this is for which you will get investigated, and sometimes you're investigated later on when you are not able to, have a child. That's where the investigations begin, because otherwise everything was normal, so you didn't even know that what's happening. And when the investigations for infertility begins, you understand that okay, she has PCOS, and then you have to go back and set it right.
Right.
Yeah.
Does PCOS only affect reproductive health or other health aspects too?
No, so PCOS is not limited to your reproductive system.
Yes.
PCOS is more than just ovaries.
Does nutrition affect the condition?
Nutrition plays a very important part in managing PCOS. Like I said, that if your nutrition is not right, if you are eating too much of processed food, what happens is because of processed foods or too much of junk or sugar cravings or eating too much of sweets and chocolates, it's going to spike your insulin levels.
Yes.
As it is with PCOS, you have insulin resistance.
Right.
So then that insulin that is rising up, if it's not going to come down, there is that elevated level of insulin always in your blood. Right?
Okay.
And that's how then obesity is there. Then again, it's like a chicken and egg situation, wo chalte hi rehta hai unless and until you break it.
Okay.
So you've got to break it at some point of time. It's not always about eating salads, yeah. So it's not about not eating the foods that you like. It's also about making mindful choices. That's something that you really need to understand when it comes to nutrition.
Okay. Thank you, ma'am. Can PCOS increase in severity if there are any mental health issues?
So again, it's like, body and mind are aligned. So in homeopathy, we believe that it's a psychosomatic thing that we look at yourself, that psyche can affect your soma and your soma can affect your psyche.
Right.
Okay, so it's both. In case of PCOS, what happens is, like I already spoke about, there's so much that impacts the mind of the person, right? Even if people are not judgmental, she herself is also judgmental.
Yes.
Okay, so we have to get her out of that.
Yes.
And you have to provide her with strategies that is going to help her heal herself.
Okay.
First thing that comes with a PCOS patient is accepting that I have this condition and I need to work towards this condition and I need to make myself better. Right? So where are you going to break it? So if you can start with including healthier foods into your diet. If you have a friend or a girlfriend or a sister, okay, why leave out the sister, right? So you are that close that you are observing her day in and day out, right? So you are observing changes in her. So you just got to go and ask that, hey, what's wrong? Do you want to talk? And just ask her now if she wants to talk and if she's willing to talk. Initially, she may not be willing to talk because she might feel कि क्या ही पता वो क्या करेगा, मुझे समझेगा भी कि नहीं समझेगा. So that's how it starts. So you will have to break the ice at some point, but that ice is broken only with conversations, okay? But you can definitely say that, okay, you look wonderful today. That small thing of appreciation you appreciate that person, you be a support to that person, you just make them feel wanted and loved. At least that much I think all guys can do.